Okay, I'm Christiana, and I'm gonna do a demo today for parents out there looking for empowerment on how to help your baby or your child settle with different types of symptoms. So, especially newborn babies or babies in the first 6 months of life, we can have all kinds of issues with latch, difficulties breastfeeding. You may have even heard of tongue tie, and you've gone to see the doctor, you've done an assessment, and you're trying to find some holistic ways before you actually go and do a frenectomy. One example. Another example is just a child at home that's having any of these symptoms. So I'm gonna go through a list of common ailments that we see from misaligned bones, misaligned tissues, or just impediments in the fascial field that are interrupting lymphatic movement or cerebral spinal fluid movement, any of the fluid tissue or fluid body in the body. Excuse me, any of the fluids in the body. So what we're gonna do is a do-at-home stretch routine, just a protocol that you can have, very easy to go through, downloadable off my website in the free resources section with a PDF that you can take and you can print it off, mark them off as you go. What I recommend is when you're dealing with babies, you wanna do these stretches as much as you can during the day, anywhere from 6 to 12 times throughout the entire day. And you can even incorporate it in just your holding routine or your playtime, any kind of bonding time, bath time. So you don't have to do the full protocol all at once. But the big key is that when you are doing the protocol, you want to make sure that you're making eye contact with your baby, that you're watching different facial gestures or just expressions that they're making, because their face is going to show you when you run into a bump. For instance, like if you're lifting their arm up and you're like, and you see kind of these contortions or twists in their face, or maybe they even cry, that's a cue that they're feeling discomfort and there's something that's tight in that arm or even in the back chain or on the side, the lateral part of the body that's even leading into the hips. So remember, babies that are coming out of the womb, they've been crunched in tight space, and then some of them go through vaginal birth, and that's a lot of pressure that kind of manipulates or twists or compresses, drag forces that go against their bones. So all of this is to unwind difficult and tight spots in the body so that a baby can rest better, be happier, breastfeed better, poop better, eat better, and just feel good all over. And what I have is a little reborn baby doll that I'm gonna kind of go through the protocol with and just make sure that you're breathing deep. You're not trying to do these stretches or these movements in a fast pace. That's key. The point is that you want the baby or the child to feel like this is good. This is therapeutic. This is like a nice stretch. So when you hit a bump and you hit a little facial gesture that's like, or a cry, you're gonna wanna ease off a little bit. So like if you're stretching the arm up and you kind of run into a tough spot, that's the limit for that day. But the goal is that you want to get into a straight alignment, right? What we call like the plumb line, for instance. So lining up the arm with the ear. And when you have that straight stretch that can take place, that's when you know that their upper spine, their neck is in alignment. So you're working towards a goal, overall alignment. If your baby's not there yet, it takes a number of days of you doing repetitive stretch exercises for them to unwind. So starting with the first thing that's really simple to do is inversion, especially with babies, even with small children, they love it. And a lot of people can be a little fearful, like, what? You want me to hang my baby upside down? And that's right. It's like going to the chiropractor, right? When you do a down dog in yoga, or you do a headstand or a shoulder stand, any of these things where you're putting your head below your heart, you're inverting your body, and it's creating a decompression of the spine. It's opening up circulation because it's changing the way that gravity is oriented to the body in a normal stance, right? So it's a way of just flushing things out using gravity. So what we're going to do with a child that's heavier, you're going to want to grab the base of their legs. But for an infant, you can just grab their ankles. You cup their ankles with your fists or your hands. You just wrap your fingers around. You've got your thumbs in alignment here or up against the base of their feet. And you just have them down on their pillow. So here we've got this baby. You're on a bed or you're on the couch, or maybe you're even in your car and they're like in the car seat or in your lap. Doesn't matter. This can be done in a lot of places. So you're going to grab the baby gently and be cooing, talking like, oh, guess what? We're going to do a little hang time. And you can do this with your partner or somebody to help at first, just so that they can help see the face of the baby. But you're just going to gently hang them and just ever so gently twist their body. And you're going to see them move around in ways that show how their body is in alignment. And you're going to see them deviate from the midline. When you see that deviation, that's when you're going to see how they're misaligned. And over time, as you're doing this decompression and you're gently twisting baby, just kind of oscillating them a little bit, you're letting this tissues that are between the spine, the collagen and all that, kind of rest in and release any trapped air pockets, release any congested fluid, get the blood flowing, all that good jazz. You can do this for up like 45 seconds, a minute. And again, just gently, you're going to have them lean your body forward and have their head just kind of rest against whatever surface that you have, something hopefully soft that you can put their head on, and then lean them down and then be like, oh, well, wasn't that fun? Good baby. All that jazz. So that's our first step, inversion. You can do that a lot. Kids love it. And it's really great also for proprioception, which is just their sense of orientation in space. So very, how do I say this? Stimulating for the nervous system. Good for brain growth. Okay, so moving on. What we're going to do now is a little bit of a stretch routine. And the PDF that you can download on my website has this as a checklist, all right? And you can just go through and see, you can mark on the little table, kind of noting the distance. Maybe they got 35% for a full stretch, or 50%, or 75%. This is not like exact numbers. This is just for you to use at home to kind of give you something to compare over time. Be like, oh yeah, like 5 days later, in the beginning we were at 25% for him to be able to do the full stretch. Now we're at 75. So it's a great tool for you to actually assess metrics that there is progress that's being made. And it's great encouragement for you as parents. Okay, so this first exercise that we're going to do is the legs, what I call double knee up. And you're going to take your baby always, so your baby's either, facing you so you can see their face, or you are the partner, parent who's on the other end by their head, and you're able to assess what's going on while the other person is actually doing the exercises, if that helps in the beginning. So what you're going to do, double knees, this is simple stuff. All you're going to do is bring their knees all the way up, right? And you can take your hands on their feet, however you can best manipulate their body, and crunch into their belly. And you're wanting goal 10 repetitions. That's a goal to start with. If you only get 3 done, that's okay. That's a beginning. Mark it down that you got 3 done and there was a lot of resistance, for instance. Or maybe babies, no problem. Knees right up into the belly, no problem. It's a cinch. However, you're going to find that a lot of babies that have things going on in their back, their mid-back, upper spine, it's going to be kind of uncomfortable. And also if they're constipated, because there's a lot of congestion in the abdominal region. So it's going to feel a little uncomfortable. You may get some gas. This is a great exercise to help them release in the tight areas in their back and also free up their digestion system. So you're doing this, you're manipulating their digestion system in a way that they don't have the muscles that are necessarily strong enough or developed enough to be able to work through some of this food that they've digested. So again, this is also a great way. Babies waking up a lot at nighttime, or there a lot of fussiness, or you're thinking they're constipated, double knees up. So double knees up all the way into the belly 10 times. And remember, when you're starting, if you only get 5, 6, whatever it is, mark it down. How many were you able to do before baby got really fussy or showed that they were really uncomfortable? Okay, so double knees, we did that. Then you're gonna do your bicycles. Very simple, one leg at a time. So you're gonna hold one leg down. And the idea is that you're holding that down to create a resistance in their psoas muscle, or just in the chain of the leg that's still, that's stagnant, the one that you're keeping kind of pinned. And you're gonna move the other leg up, and you're gonna push it into the belly, and you're gonna do this 10 times. And this is going to give you a little bit more working in the psoas and the hip flexors and stretching out the front anterior part of the body, while also working their hamstring, the backside of their glutes that could be tight, especially from sitting in the womb. Then you're gonna do the other side. So you're gonna do 10 repetitions on the other leg. Simple bicycle, 10 times each side, okay? Moving along, now we have step 4, which is leg circles. And this is like hip. So what you're doing here is you're getting their knee, you're kind of cupping their knee, and then you're just gonna rotate their leg, externally rotate it. And you're kind of gonna go up in a circle. If you can see this baby, we're moving his leg around and just doing some gentle hip circles. And the reason why we're doing the hip circles, we're opening up that joint that really gets compressed in the tailbone. And this really helps with cerebral spinal movement that pulls down at the base of the sacrum. So again, you're flushing this whole system. You're getting mobility in the joints of the hips that get really kind of tight and congested. So baby may not like this. And you're gonna notice, like just watching the face or their facial expressions, or if they cry, you're just gonna go until they make that discomfort look and stop. You're gonna notice one side's probably easier than the other. Mark it down. So when you're kind of getting in and you're learning your baby's body, you're remembering this stuff from each set that you do the protocol and noticing how you're developing, how you're progressing. So once you do one hip, then you're gonna do the other hip. So you're gonna do the opposite hip and rotate it outward, and then you're gonna rotate it backwards. So you're gonna go kind of clockwise one way, and then counterclockwise the other way. 10 times on each side. Remember, parents can be like, oh my gosh, I'm not gonna get all this in. This is why you can split it up, and you have the checklist and you hang it in your kitchen, or you have it in near the diaper stand, whatever it is. So you have that as a reference point. It's like, oh, I kind of left off here, let me pick up. Once you do the hip circles, now we're gonna get into the lower spine. So you have baby on their back, and you're gonna do this side bending. So this is where we have baby here, and you're gonna keep somebody or yourself, hold their shoulders gently, just to keep them on their shoulder blades, both on the surface where you have them. And you're gonna bring their hip up and twist their body, okay? And so you can see me, because this is a plastic baby doll. I don't have a fabric baby doll that's a lot more flexible. But in this case, you see me putting a little pressure. You don't have to put much pressure on a baby. You're just kind of holding their shoulder down, the opposite shoulder of the side that you're pushing the hips towards. So you're kind of doing this side bend, where you have them shoulders here and you're moving their hip to the side. So you're opening up this whole chain of their back, okay? So once you do one side, we did that one to the right, then you're gonna do side bending to the left. Bada boom, now you've done through 7. We've got side bending to the left, side bending to the right. You've done through 7 different protocols. On the left, or on the sheet here, it's got number 8, which is seated turn to the left. So now this is where you get to put baby on your lap. So you have baby kind of facing out, bouncing around, and you're gonna do a seated turn. So you're gonna have your hands just go right up under their armpits, and you're gonna straddle them. See, I've got this pillow here. But you're gonna put their legs just over, like you're gonna saddle their legs here. So they are stable and grounded. And you're just gonna twist their spine. So this baby's turning, seated, turning to the left. You're gonna do this up to 10 times. You know, you may not get through the full, remember? Then you're gonna twist to the opposite side. So seated, turning to the right. Now you've gone through 9 steps. Now here we go to the arms. This is when you're kind of really opening the upper spine. So you're gonna wanna have one arm raise. And remember, we wanna get this arm all the way up to the ear. All the way up to the ear. Some babies may only be able to go here. Some babies here. And because that's really starting to move this shoulder blade area. And if you've got tongue tie issues, now we're starting to get into these upper traps of the spine or of the shoulders here and into the cervical spine of the back. So you got tight neck, tight jaw. It's going to be hard to lift these arms. So this may be a challenge for babies with tongue tie, and that's okay because you're working this out over time. You're going to get much more mobility in the arms and capacity for them to get all the way up to their ears. So as you're seated, you're going to be doing this right arm up, and then you're going to shift left side, one arm at a time. Then once you have done both arms single, now you're going to rotate the neck to the right. Just gently twist their neck as far as you can get it to the side here. We're stretching these neck muscles. Feels good. Bring in baby's head back. Again, you can have somebody in front of you in the beginning as you're kind of learning the body language of your baby. And you're twisting to the side, and then you're twisting to the other side, right? Okay, so we're getting a lot of head movement here. Now, once we've done both rotating the neck to the right and to the left side, now we're going to observe the mouth symmetry. So you can look at my face right now and you can see that, whoa, my nose is crooked. Now, babies oftentimes have faces that aren't symmetrical. And this is from the birth journey. And what I love, I learned this from Carlton Terry, an expert baby therapist. And that was something that he calls the BMR, which is the birth mask reveal. And he'll take a photo of a child while they're working together or get a baby picture from the parents. And then he lines it up so there is the forehead, or what we call the bindi point here, is lined up straight and down, vertical axis. And you can see from the picture, and maybe I'll throw one up on the video when I'm processing this so you can kind of see how we draw on it to see the asymmetry in the face. This shows us the drag and the compression forces that happen during the birth. It also gives us a lot of information for what's going on inside of the skull. So why you care about this? You want to just see, how is their jaw aligned? Maybe their lips are a little crooked. Maybe one side of the mouth is up higher than the other. This is an indicator that they got some stuff going on inside the cranium. When this happens, you know, we really can't do a lot with the stretch routine, but we can do a lot with craniosacral therapy, which opens up this fluid field inside of the brain and inside of the structures around this kind of gelatinous, bony material that hasn't really solidified yet. So there's a lot of forces that can work in a baby's head, especially the younger they are, much more so than an adult that has more ossified bones. So just a tip there, craniosacral therapy really helps with opening up and jaw function and what's going on with the sphenoid bone and the cranial bone, the facial bones, all of this that can get compressed and just misaligned during the birth process itself. So you're gonna wanna look at your baby's mouth symmetry. Make some notes. Reach out to a craniosacral therapist. You don't have to be in person. You don't have to leave your home to do craniosacral therapy. I do distance therapy all the time. There are other therapists around the world who work with this like quantum field, energetic treatments, and hopefully are coaching you how to notice the energy in and around your baby so that you can help palpate your baby through consciousness, through attunement, while you're breastfeeding, or if you're not the breastfeeding parent or you're not breastfeeding, when you're holding the baby, and different opportunities that you have to put your hands on head and really intentionally imagine space opening up. And there's a lot you can do as a parent with conscious intention. So more tips on that on another video, but for now, check out the mouth symmetry. And then you want to kind of go inside the mouth. Now I put on gloves. My gloves aren't here. When I'm working with a baby, I'll wear gloves just because I've washed my hands and I'm going in the mouth. So if you're parents, you just want to make sure you wash your hands before you go in. Use your pinky finger, and you're gonna go in and just scoop up the roof of their mouth and just see how maybe arched the mouth is, and notice how they suck or they latch. Maybe they have a strong pull, or maybe they don't have a strong pull. But there's a great way that you can release the pterygoid muscles, which are the muscles that are kind of like right at the hinge point of the jaw. And when you go inside the mouth, and I'm going to demonstrate this now, you use your pinky finger and you kind of think about the texture of this muscle pad that you have in between your index finger and your thumb. And you want to kind of feel for that. There's not much pressure that you have to put here for a baby inside the mouth. So you're going to open up kind of where the jaw hinges, and you're going to feel around for any knots, any circular, ropey like sensations that you get right in the hinge of the jaw. So I'm going to open my mouth. Can't talk while I do it, but just showing you. Open my mouth. We're palpating this pterygoid muscle that gets real tight, especially with babies that have been in the womb and their moms had a lot of stress for whatever reason, and they're kind of like, just like we do in real life, we bear down with our jaw. And that type of bearing down or that tension in the field makes the muscles real tight, and they get trigger points. So you can go inside the mouth and just gently massage their mouth. And you're gonna feel the difference, because the cheeks on the inside, if you're not on the pterygoids, it's gonna be kind of mushy, squishy. When you start hitting some of this hard material that's a little bit more firm to the touch, that's when you know you're on muscle, okay? And that muscle that you wanna work, if there's any stiffness, just kind of gently with a light pressure on your pinky finger, you're gonna circularly move your finger pad over this muscle to just release. And babies have a lot of like easy melting, so it doesn't take a lot of pressure, whereas you and I, maybe you have to kind of dig in there. With babies, it's more like you're putting your finger in there and you're using your intention of like, just kind of a heart space, like I want this to melt. And you're going in ever so gently, and baby may be squiggling, and this may be uncomfortable if their jaw is especially tender, and you're having compassion for that. Like, oh, I see that's a little hurt, that aches for you, yeah? And you're just gentle with it. Just see how far you can go and how much they'll tolerate. This goes a long way inside the mouth. In fact, you can do it to yourself and be like, have so much release and relief. Also, you can work baby's jaw on the outside. So you can just work on these masseter, muscles on the outside that are really broad stroked muscles. And you're just gonna kind of go in there again, either with babies, we wanna use our like ring finger or our pinky finger, because there are weaker fingers, so we don't put as much pressure on as we would with our thumb, our index. So good tip. Ring finger or pinky finger, and you're just massaging the cheekbone here from the outside. And you can do that while you're holding the baby, while baby's breastfeeding. And you'll see even while baby's breastfeeding, great way. Okay, let's check this out. Anybody who's got their baby at this distance from the chest to the eyes, this is usually where they can actually, their scope or vision extends to just this distance here. So it's really a beautiful design. When they're here at this distance, you can really attune to their energy field just by checking out their facial expressions. And while you're palpating their face, like notice what's happening in their body. Are they happy? Are they smiling? Are they cooing? Or they're like, oh, this sucks. That will tell you where they are in their comfort level. And sometimes you can even see them where they're just like, oh, thank you for noticing what I went through, because it's really a different story when you start kind of bridging the gap of the baby's experience going through the birth canal or whatever type of birth that you had. And you're now making links like, oh, wow, I see what happened. I see what happened to your face. Or, oh, wow, I noticed there's this dent in your head there. That must have hurt when it happened. And even just having your fingers lightly on any kind of compression areas that you see that are indented, or let's say malaligned, let's say their eye is lower than the other eye, or maybe their eye's pushed in a little bit, or their nose is really puffy over the bridge and you can see some swollenness there. All of these are signs of just trauma of going through the birth canal. And you hovering your hand over this area is really amazing stuff can happen in this space. And you can even feel heat. The areas where there's a lot of trauma or a lot of compression, there's a lot of heat. And when you can hold your hand there and attune to your baby, let's say we got some eye trauma going on, and you just hold your hand there and be like, I see that. I can feel that. Owie. Wow. That's when you start metabolizing it for them, and you're like kind of doing craniosacral therapy on your own. You're learning how to palpate the energetic field. And they're like, wow, because babies are wide open to this stuff. They're really in a liminal space, coming fresh from the other side. So it's a great way to just help baby relax, let them know that you really care and that you see what's going on in their story. Because when babies are going through birth, we can't see any of that stuff. They're on the inside, you know, they're behind the veil still. So this is just a guide, kind of a 101 steps that you can do home stretch at home to really open up your baby, unwind from birth, unwind from tension, get the kinks out, have a lot of good brain development taking place, because a baby that's aligned is a baby that's gonna really grow in all the positive ways that we want to see baby grow. So hope this helps. Enjoy for now. If you have any questions, you know how to reach me through the website or through a contact through our email. All right. Thank you so much for listening. Bye for now.